Hello, my name is Darian Thomas. I am a student midwife, and it is my responsibility to educate my clients so they're empowered to make healthy decisions and habits during pregnancy. So today's video is about working in pregnancy, part 2 of my series in the client educational series. Today's topic is going to cover risks and benefits associated with working during pregnancy, your rights, and resources for you to follow up with. First, the type of work, the hours worked, and the environment in which you work all contributes to a pregnant person's tolerance. Workplaces that pose an environmental hazard may need to be evaluated for safety. Check with your employer to learn more about how you can find out if the chemicals in the environment in which you work in can pose an environmental threat to you and your unborn child. In the case of, your provider will provide you with support in getting accommodations for a leave. If the type of work poses a threat to your physical health as far as heavy lifting, bending, or squatting, then you also may need some accommodations for a leave because your physical health is important. If extended work hours and overtime and just heavy hours are affecting your mental health, that is also a reason for a need for an accommodation. While yes, I'm sure your provider wants you to get exercise, it's not what you do, it's how you do it. If the exercise at work that you are getting is stressing your body and your mind out, then you may need to do other forms of physical activity that isn't posing a threat to your health. Talk to human resources or check out the handbook to know the benefits and the insurance that is associated with pregnant persons in that workplace. Also, know your rights. Check out your state's work laws and civil rights laws so that way you are aware of your rights as a pregnant person and a person in general in a workplace. Another great resource is pregnantatwork.org. Check it out. They have resources on pregnancy accommodations and breastfeeding accommodations for the postpartum period. You may be eligible for short-term disability benefits, paid leave of absences, and FMLA, family and medical leave, where you are paid for time off. Some commonly asked questions are, can I work during pregnancy? When should I cut back? And how long should I plan to be off work after pregnancy? And these are questions that, one, you should also ask yourself. You know your body, you know what you can tolerate, and you know what you are capable of. Although most pregnant persons want to go on leave from work at their 38-week mark of gestation, and some people want to leave at 35, some people may even want to leave at the onset of the third trimester at 28 weeks. You can continue to work if your workplace is not putting any unbearable physical activity on you, any stress, then you are okay to work, or not posing a threat to you and your unborn child, and it's safe and it's a safe environment. You can continue to work, and as long as they support you and your rights during your pregnancy, and as long as they're supporting your basic needs of needing to stay hydrated, needing to rest throughout work, as far as breaks, and just knowing when and recognizing when you are at your capacity, at your limit, or when you're overworking yourself. When should you cut back or stop working? That question is absolutely really up to you, because I know some pregnant persons that work all the way up until they go into labor, some that stop at the onset of the third trimester at 28 weeks. It's just what you can tolerate and what your lifestyle can allow for. How long should you plan to take off after work? Well, you got to remember that you are healing a wound and you are recovering from giving birth. So, ideally, I would love to say, of course, a year. Women need a year to recover after giving birth. But our lifestyles and this country we live in does not always accommodate that. So again, you must ask yourself that question. Are you physically and mentally okay and ready to go back? Is your child still going to be able to feed? And are you going to both be okay when you return? Just remember to be realistic with yourself and know your rights and take care of you and your home first. Thank you for watching this educational video on working in pregnancy. I hope you learned something.